Finding a lump down there can be really scary. Most women immediately assume the worst, but the truth is, not every lump is cancer. In fact, most of the vaginal or vulval lumps are treatable. In today's video, we're going to talk about some of the common causes of vaginal or vulval lumps, what they look like, how they happen, and when you should actually be concerned enough to see a doctor. The first one we'll talk about is the Bartholin cyst and Bartholin's abscess. The Bartholin's glands are two small glands on either side of the vaginal opening. Their job is to produce fluid, and this fluid helps keep the vagina lubricated. This fluid drains into the vagina through tiny ducts. Sometimes these ducts can get blocked by things like thick mucus, swelling, inflammation from minor trauma which can be gotten during shaving. Now when this dot gets blocked, the fluid can no longer come out, so it accumulates inside the gland to form a lump. This is how a Bartholin cyst forms. Now, if bacteria gets into the Bartholin's duct or into an already formed cyst, it becomes infected. This is how a Bartholin's abscess forms. The bacteria that causes Bartholin's abscess are the same ones that lives on the skin and in the vulva. But sometimes it can be caused by sexually transmitted infections like gonorrhea and chlamydia. So in simple terms, a cyst happens because of a blocked duct, while an abscess happens because of an infection. A simple Bartholin cyst is painless, but sometimes the cyst can grow so large that it makes walking, sitting, or even having sex uncomfortable. The reason for this is because of the pressure of the large cyst on the surrounding tissues. An abscess, on the other hand, will be swollen, warm, and very painful. It can make the person's life miserable. The treatment of Bartholin cyst and abscess depends on the size and symptoms. Sometimes the cyst can go away on its own. Warm cyst baths can help a small cyst disappear, and they can also help a small abscess rupture and drain. If the woman is experiencing pain, the doctor can prescribe painkillers, and if there's an infection leading to an abscess, antibiotics will be prescribed. The doctor can also perform a special procedure to drain the abscess and prevent a recurrence. It is important to know that Bartholin cyst and abscess can be treated effectively. So, if you experience a lump like this, don't feel shy or embarrassed. Go see a doctor to get it checked out. The second one we'll talk about is genital warts. Genital warts are sexually transmitted infections caused by human papillomavirus, commonly known as HPV. The culprits for visible warts are HPV types 6 and 11. They are not the same ones responsible for cervical cancer and other cancers. These warts are found in the vulva, around the vaginal opening, the anal region, and sometimes even inside the vagina. They appear as small skin-colored bumps. Sometimes they appear alone, but most times they appear in clusters to look like tiny cauliflower. These warts are not painful, but they can itch and bleed. There are treatment options available for the treatment of genital warts. Number one, do nothing, because sometimes the warts can disappear, but most of the times they don't. Other treatment options are the use of prescription self-applied creams, cryotherapy, which involves freezing of the wart, and electrocautery, which involves burning of the wart. It is important to know that these warts can recur. This is because human papillomavirus can live in the body for a long time. So if you are eligible, you should consider getting vaccinated because HPV vaccination is a key preventive measure. The third one we'll talk about is genital herpes. Genital herpes is caused by herpes simplex virus, usually herpes simplex virus 2. It causes painful fluid-filled blisters that burst to form ulcers. Some persons experience tingling, burning sensation, and itching before the sores appear. It is important to know that herpes can be gotten through direct contact, not only bodily fluids. It can spread through vaginal sex, oral sex, anal sex, and it can also spread through oral sex from a person with cold sores. The tricky thing about genital herpes is that even without the presence of visible blisters, the virus can still be passed on. This is because of something called asymptomatic viral shedding. In asymptomatic viral shedding, the virus is active on the skin but without symptoms. So, such a person can still pass on the virus to a partner if there is close contact. Another possible route of transmission of this virus is through the sharing of sex toys, especially if they are not cleaned properly or if they are not protected with condoms. This is why it is important you practice safe sex and avoid contact during an outbreak. Now, the first outbreak is usually the most painful, and an infected person would continue to have recurrent episodes over time. Some persons with herpes do not know that they have the virus because the symptoms may be mild or it may be mistaken for other conditions like syphilis and genital warts. There is no cure for genital herpes, but antiviral medications can help reduce the frequency and severity of attacks, and they can also help lower the risk of transmission. The fourth one we'll talk about is sebaceous cyst. The sebaceous glands produce oily substance called sebum. This sebum comes out through a dot in the follicle to help moisturize the skin. Sometimes this dot can get blocked by things like dead skin cells, acne, inflammation or trauma from shaving, waxing, and even squeezing of a pimple. Now, when this dot gets blocked, the sebum can no longer come to the surface of the skin. It accumulates under to form a small round lump called the sebaceous cyst. This is why this cyst is common in areas with a lot of hair follicles and oil glands like the scalp and genitals. It is important to know that sebaceous cysts are not infections and they are not sexually transmitted. They are usually not treated unless they become infected or they are causing discomfort. Then removal or drainage may be done. The next one we'll talk about is lichen sclerosus. Lichen sclerosus is a chronic skin condition that affects the vulva. It causes white patches, thinning of the skin, and intense itching of the skin of the vulva. Over time, it can lead to scarring and changes in the shape or appearance of the vulva. It is not an infection and it is not sexually transmitted. The exact cause is not known, but research suggests that it is autoimmune, meaning that the immune system becomes overactive and starts to attack its own skin. It can happen at any age, but it is more common among postmenopausal women. While it is not cancer, it slightly increases the risk of developing vulvar cancer. So it is important if you get a swelling or lump like this, you should get it checked by a doctor. Treatment involve long-term use of topical steroid creams to help relieve symptoms, reduce inflammation, and prevent complications. The next one we'll talk about is vulvar psoriasis. Psoriasis is an autoimmune skin condition, meaning the immune system becomes overactive and starts to attack its own skin. When it happens in the vulva, it causes red, shiny, and scaly patches. It can itch and cause discomfort, but unlike an infection, it doesn't cause discharge. Because the vulva is a moist area, psoriasis here may be different from psoriasis in other parts of the body. It will be smoother and less scaly. Treatment involve the use of topical steroid creams, moisturizers, and other prescription medications to help relieve symptoms. Finally, the last one we'll talk about is choriocarcinoma. Choriocarcinoma is a rare but serious cause of vulvar lump. It is a malignant tumor that arises from pregnancy tissue. A vulvar lump in this case will be firm, irregular, and possibly ulcerated. Other symptoms that may accompany the lump include vaginal bleeding and pelvic pain. So, if you get a lump like this, you should get it checked out by a doctor as soon as possible because early detection and treatment are important for good outcome. If you watched the video this far, like this video and consider subscribing to the channel for more videos like this.